Patient safety to me means do no harm. It's the ability to prevent, reduce patient harm through medication delivery, their medication treatment. As pharmacists, our job is to help increase their wellness, but then also reduce the harm that medications can have against them.
I think patient safety to me means patients feeling comfortable and being vulnerable and trusting their providers as well as the staff, because at the end of the day, it's important for them to feel like they're being taken care of and having trust within the team.
Sure. So patient safety to me means preventing errors that could adversely affect patients and promoting health. I think preventative care is just as important as diagnostic care, and patient safety falls under that domain.
Patient safety means to me selecting the appropriate drug for the indication for the patient, as well as the appropriate dose to therapeutically treat that patient, and then also preparing the patient via patient education for them to accurately use the medication at home and reduce the risk for harm.
Everyone is responsible for patient safety and making sure that we take the best possible care of our patients.
It's everyone's job to be responsible for patient safety. We all should work as a team. So the medical students, the attendings, the nurses, the lab technicians, the environmental services, the cafeteria, like everyone should be looking out for the best interest of the patient.
I think for the most part, it's our responsibility to ensure that patients are safe, but I think it's also kind of on them as well to be able to ensure their own safety. And in that way, we kind of work together as a healthcare team in order to optimize the safety of our patients.
I think that everybody is responsible for patient safety. We all play a part in all of our different roles that we have here in the healthcare center.
Being a pharmacy intern and working in a community setting, it affects my everyday life because you take that step when you're at work to make sure you build that relationship with your patient, whether it's having that conversation at pickup with them or making a quick phone call to make sure is this dose correct and making sure they're taking the right medication.
You know, is my number one job. Every time I step into the clinic, the hospital, or I'm just on campus, I'm looking out for the safety of my patients, and it's the utmost priority.
Well, patient safety should be something that is at the forefront of all of our minds every time we encounter a patient in any site of care.
If there's one thing that improved patient safety, when you look at aviation, nuclear power, everybody's looking for errors in order to correct them immediately before they become a problem. And I think that's the kind of culture we need to be in.
To have more time interacting with patients. I believe that it's really important to take the time out of our busy schedules and really sit down and talk to patients and make sure that all of their questions are answered.
I think main thing about patient safety is communication. Although healthcare does have a good communication in place, I believe encouraging better communication and continuing to encourage communication will be good for patient safety.
The one thing I would change with patient safety or to improve patient safety is to find the best method for medication reconciliation.